Hey Baltimore, it's Mayor Brandon Scott
and Health Commissioner Dr. Leticia Jarraza.
The Easy Enrollment program gives you a special chance to get health insurance for the year. And it's as easy as checking a box when you file your taxes. You can apply for Medicaid any time of the year. The 2021 tax season is here, and if you're uninsured, you still have a chance to get health coverage through Maryland Health Connection, the state's health insurance marketplace and the only place to get savings. Marylanders can check a box on their state tax return to share information with the Maryland Health Connection. Within a week, you can expect a letter in the mail. This unlocks a 35-day enrollment window starting from the date on the letter. Check the box on your state tax form to get access to checkups, check in with a doctor, or get that funny-looking mole checked out. The Easy Enrollment program runs through tax season. Marylanders are eligible for their own special enrollment period when they file their taxes anytime before April 15th of 2022. To do that, they need to check that box. This is your last chance to get a 2022 health plan and save. And if you're not sure if you need health coverage, check the box to unlock your special enrollment period. You can make a decision about coverage during the 35-day window.
Maryland Health Connection is the state's official health insurance marketplace. It's your one-stop shop to browse and compare health plans, find savings, and get covered. All plans available through Maryland Health Connection cover important health benefits, including doctor visits, prescriptions, mental health services, and more. Maryland Health Connection offers health plans from insurance companies you know, like Care First, Kaiser Permanente, and United Healthcare. You can get free or low-cost health insurance through Maryland Health Connection. In fact, 9 out of 10 Marylanders who enroll get financial help to pay for their plan. Thanks to a new law, Marylanders with higher incomes can now get financial help to cover some of their health plan costs. Even if you've shopped before, it's worth coming back to check out your options. There are new discounts for Marylanders ages 18 to 34 on top of other savings available through Maryland Health Connection. Don't miss your chance to save in 2022.
Trained experts are available to help you sign up for a health plan from the comfort of your own home. Go to marylandhealthconnection.gov/help to find help near you.
You may get a call from a trained expert. They will be able to help you activate your special enrollment period, compare health plans, and enroll.
The Maryland Health Connection call centers offer support in more than 200 languages, including Relay for the Deaf and Hard of Hearing. Call them toll-free at 1-855-642-8572. That's 1-855-642-8572.
Hello, everyone. My name is Vinny DeMarco, President of the Maryland Healthcare for All Coalition. We are thrilled to be here, and thank you for coming. Maryland is one of the best states in the nation in providing healthcare coverage, 5th best state in the nation in healthcare, because in a bipartisan way, we have fully implemented the Affordable Care Act and reduced by half the number of uninsured in our state. We have less than 6% uninsured, which is great. And one of the reasons is we have one of the best, if not the best, health benefit exchange in the country. But there's more to do. We just finished the regular open enrollment program, and now people can enroll in healthcare through our first in the nation Easy Enrollment program. And we're thrilled that that's there now for people who, when you file your taxes, you could check a box and get enrolled. And we are just so excited that Mayor Brandon Scott and Commissioner Leticia Jarraza have put together a video, which you should all have, which we're going to be putting out there to the public to let them know, check the box. And if you're uninsured, get yourself insured. There are many new subsidies that President Joe Biden and Vice President Kamala Harris and the Maryland General Assembly has enacted in Maryland specifically for young people to help you afford health care. If you're uninsured, check the box and get insured. And I'm going to start today by introducing my mayor, who I love, who is just a great leader for the city of Baltimore on many issues, but I know particularly on public health. He believes in public health. He makes public health happen. He worked for us to get enacted our first in the nation Prescription Drug Affordability Board law, our first in the nation Easy Enrollment law, and now he's helping us to implement those measures. So it's with great honor that I introduce Mayor Brandon Scott. Mayor?
Thank you, Vinny, and thank you for all of your work throughout the years to make sure that residents of Baltimore are healthier. And good afternoon, everyone. It is great to be here alongside so many leaders who are working to uplift the health and well-being of our residents here in our great city. I want to recognize our amazing Health Commissioner, Dr. Jarraza, Vinny DeMarco, United Healthcare, and Michelle Eberly, Executive Director of the Maryland Health Benefit Exchange. We have all been through a lot during the COVID-19 pandemic, but it has made us all much more aware of the importance of both individual and community health. And we are here to talk today to talk about a great way to get health insurance if you are uninsured. Easy enrollment is as easy as checking a box when you file your taxes. This is the last chance for residents to get a 2022 health plan and save money. If you are unsure about whether or not you need health coverage, you probably do. But you can still check the box to unlock your special enrollment period. You can make a decision about coverage during the 35-day enrollment window. Everyone needs health coverage in order for us to not just deal with the pandemic, but the other health issues that we know exist in so many neighborhoods in our city. Being uninsured put residents at risk of unwanted and heavy medical debt. So engage in the early enrollment period and get insured as soon as possible. Once you check that box within a week, you can expect a letter in the mail. This unlocks a 35-day enrollment window for discounted insurance coverage starting from the date on the letter. Again, I want to urge all those who need health insurance to take that simple step and check the box on their tax return and get started enrolling in coverage. Thanks to the advocacy and hard work for everyone involved, Maryland, our state, has been a leader on easy enrollment innovation, and we are making it even more convenient than ever to get health insurance. So, if you don't have it and you need it, everyone needs it. Make sure you go through the process of getting insured this tax season. Thank you.
Thank you, Mr. Mayor, for your leadership. And we are thrilled in Baltimore to have one of the very best health commissioners, not only in the state but in the nation, who has done so much to protect Baltimore and during this COVID epidemic, and is out there now helping us get people enrolled through getting the message out about the Easy Enrollment Program. I urge you to look at that video. It's great, and it'll be all across the state. And it's my pleasure to introduce Baltimore City Health Commissioner Leticia Jarraza.
Thanks, Vinny, for that introduction. Thank you, Mayor Scott, for your leadership. And thanks to the Maryland Health Connection for their support of uninsured and uninsured, uninsured and underinsured city residents. The Maryland Health Connection serves as the state's marketplace for residents to browse and compare insurance plans, shop for coverage based on personal needs, and get covered all in one place. Enrollment in adequate health care insurance coverage supports the health and well-being of individuals and our communities. And the Maryland Health Connection is also the only place where you can receive financial assistance on health plan costs. All plans obtained through the Maryland Health Connection are available to residents at little to no costs and cover important and necessary healthcare services, including doctor's visits, prescriptions, mental health services, and more. So during this tax season, residents, please check that box if you're in need of health insurance. It'll be located right on your tax return, and you'll be able to determine your eligibility for coverage. To enroll, you can go online, marylandhealthconnection.gov. Again, that's marylandhealthconnection.gov, or you can call 1-855-642-8572. Again, 1-855-642-8572. Or lastly, you can visit one of the Maryland Health Connection's enrollment locations where you can receive free help from an expert. So again, thank you, Maryland Health Connection, for helping to bring more equitable access to care to residents here in Baltimore City.
Thank you, Commissioner. The mayor and the commissioner have been great leaders, but none of this would have been possible without some generous foundation and other support. I want to recognize Bob Embry and Liz Tung from the Able Foundation, who supported this over the last 20 years, and without whose support, we couldn't be doing all this work. Thank you very much, Bob and Liz. And then we have some funders who specifically helped us with this video you've seen. Trey Owens and Patrice Tucker here with United Healthcare. Come on up and just stand right here so we can see you. Thank you, Patrice, and and Trey, and please thank everybody at United Healthcare and all our other sponsors you see over there. This work is very important, and it couldn't happen without an exchange that really cares and knows what they're doing. That's why I'm thrilled to introduce now Michelle Eberly, the head of the Maryland Health Benefit Exchange, the best health benefit exchange in the nation, who will talk to you in more detail about what's happening in Maryland to make us one of the best states in the nation in healthcare, and how you can still get enrolled through easy enrollment. Michelle?
Thank you, Vinny, and thank you for having us here today. And I love when Vinny says we're the best health exchange in the nation that we have here. And it's not by accident. It's by the collaboration of all the folks you see here. Mayor Scott, Dr. Jarraza, everyone here today that helps us spread the word and get people insured. So what you've heard today is we have this great opportunity, first in the nation, check that box on your tax returns, come in and get health insurance. I'm so excited to say that we've seen 7 other states, I believe, across the nation who have followed our path, and they're doing the exact same thing. So it's a great program, and we've been a model for the rest of the nation. Now, if there are folks listening today that have already filed taxes or don't file taxes, don't worry. You may still be able to get health coverage. So if you have a special life event, what we like to talk about, you get married, you have a child, you have a change in income, you're new into the state, you have loss of employer-sponsored coverage, there's other opportunities for special enrollment periods. But today, particularly, we're here to highlight the tax easy enrollment. So if you are in the midst of filing your taxes and you don't have health insurance, check that box. We will reach out to you. We'll make sure we get you connected with people that can help you and help give you the peace of mind of knowing that if you are ill or if you have an accident or even just want to improve your health through our wellness programs, you can get health coverage in Maryland, and we want to make it easy for you to do so. Thank you, and thank you, Vinny.
Thank you, Michelle. Here you heard from the best exchange, the best mayor, and the best health commissioner in the country. Thank you all very, very much. I'm glad that Michelle mentioned that 7 other states, including most recently New Mexico, have followed our lead in trying to enact the easy enrollment program. Colorado has one, New Jersey, New Mexico, Virginia, and others are following our lead. And I'm very proud to say that our wonderful United States Senator, Chris Van Hollen, has introduced a national easy enrollment law, which he's going to try to get enacted. So easy enrollment is on the move, but right now it's helping you, the people of Maryland. So with that, we're done, and we're happy to answer questions, right? Questions for anybody? Okay, thank you very much. Oh, question. Oh.
I have one question on this topic. I wonder, did the pandemic cause more people to go out and get insurance? Roughly how many people are still uninsured in the Baltimore region, and because of COVID, did more people say, I need to sign up to get insurance because I could get sick and end up in the hospital?
Well, fortunately, we were able to put a lot more effort behind marketing and reaching out to people, and through a special enrollment period we have had all throughout COVID. We tied it to the governor's health emergency. And so we did see significantly increased enrollments. In fact, we just finished with our largest enrollment ever in the history of the exchange, well over 181,000 folks that have enrolled. So yes, people were really nervous. They were concerned. They liked the fact that you can get your immunizations, you could get your testing. Of course, in Maryland, we're fortunate that we can do that. Everyone can do that. But it really did help when that's right front and center, the threat of a pandemic. You want to know you have health care coverage if you need it.
Thank you. And then I had another question. It was off topic for the mayor. I'm wondering if you had any thoughts on the 70-year-old woman who was killed this morning, and any message to those who live in that community in Northwest Baltimore.
Yeah, so this one hits really home to me. That block is a block where some of my closest friends grew up on, that I've stood on that block many days, and my first thing is to the person or persons who did that. You are a coward, you are a scum, and we will find you. we will hold you accountable. That block does not tolerate that kind of activity against anyone, especially their seniors, even though this is a neighborhood that we know has had struggles over the years, and we're going to be working. I've talked to the police commissioner right before coming here with you, and we're going to be working, as we have done, closing 58% of the cases this year to bring that person to justice. But we need people to know what kind of individual would do something like that. We cannot just allow that to happen. We have to look at ourselves in a different way when we allow cowards to go and do something like that. And we have to really check ourselves in the reality of what that is. And I know that community in particular is going to be sharing any information possible to make sure that we find that person.
Thank you, Mayor.
Thank you. Sorry, Vin, this is your
That's
press
your, no.
Mayor Scott, going on similar topic, the 70-year-old obviously found shot to death this morning. Yesterday, 5 people were shot. One was killed within an hour. This morning on the radio, you said that you believe your 5-year crime plan is working.
No, I think Mackenzie, I'll just cut you off and just start talking. So I think that what you didn't hear is about making sure that we work every day to improve upon what's happening. Yes, a 58% clearance rate for Baltimore City is a big improvement. Yes, going out and getting the amounts of gun arrests that they are getting is a big improvement. Repairing the relationships, the broken relationship with our federal partners is a big improvement. But yes, we have a lot more to do. And we also have to understand other realities. For example, there was a police officer right around the corner from this incident last night. We have to be better in every facet, and we will do that. We will make adjustments, we'll make changes, just as every city across the country who is dealing with a rise in violence is doing. We all have to make adjustments to that change, but we also have to live in the realm of reality to know that there are people out here who just simply don't care. They don't care about me, they don't care about you, they don't care about your hashtag, they don't care if a police officer is standing right there. And our responsibility is to make sure that we remove those people from our streets, turn them over to the other parts of the justice system, and make sure that they face the quick and certain consequences that they deserve. Thank you.